You're listening to a Raconteur Studios podcast.
Hello and welcome to the After Hours Skin Clinic. I'm consultant dermatologist Dr. Emma Craythorne, and this is the place where I answer all of your skin related questions. These are the kind of questions that I get asked outside my clinic everywhere I go, whether it's in the park or the playground or having a glass of wine with my girlfriends. Each week we have a mini listener question special, and this episode is one of those. I'm joined by the fabulous Dr. Ellie Rashid with the most fabulous hair. Hi Ellie, welcome back.
Hi, so which question are we tackling today?
Well, Denny has asked us about microneedling. She says that she's using Cleara.
Well done.
And has also started microneedling and wants to know our thoughts on that treatment. She also says she knows you need to have multiple sessions to see the benefit. Now, I know lots of our listeners will be curious about this one. So Ellie, for those that don't know, what is microneedling?
So microneedling is usually the application of these small little needles that penetrate into the skin at different depths. So you can normally set it at different depths, and they create this controlled injury to the skin, and the whole purpose of it is that you can then build new collagen, new elastin as a result of this trauma that you've induced on the surface of the skin. But microneedling with radiofrequency, and this is where you've got radiofrequency assisting those microneedles and their controlled trauma into the skin to then try and get that new collagen and new elastin building.
And there's lots of different reasons why people might have microneedling, isn't there? Because when you think about it, you're trying to induce more collagen and elastin into the skin. So every single time you have a microneedle procedure, it's either, when I first started using these, they were called derma rollers and everything was on a roll. So if you can imagine, if you've never seen one of these, it was a device a little bit like a lint roller, and attached to the lint roller, I can't remember, I think it was like 196 small needles all attached, and they were all penetrate at different depths to within the skin. And we used them to treat acne scarring. And there is lots of very good evidence to show how effective they are for the treatment of acne scarring. And because this device is incredibly inexpensive, then it's used globally for acne scarring. So a lot of people in very resource poor countries without exposure to lasers or other technologies can really quite cheaply get one of these devices and be able to target the scars that they might have in their skin. But the derma rollers themselves had a little bit of an issue because they created a bit of traction on the skin. And sometimes instead of a nice clean 90-degree entry into the skin, it would leave a little scuff behind. And so I was involved with some cases where other practitioners had used these devices and ended up causing lots of tiny little scars from these scuffs that the derma roller had left behind. So now other devices actually almost stamp the needles in. So you get a pen or a stamper and you have that at 90 degrees and it stamps down into the skin, and that's less associated with these scuffs that can happen, but also you get a more defined depth of penetration. And depending on what depth you want to get to, then really depends on the amount of injury you're causing. And usually the deeper you go, the better of a response that you get, until you go too deep, and then you get a real problem.
Then because you get fat atrophy.
Because then you can dissolve some of the fat, particularly with the microneedling radiofrequency, where there are several cases happening in courts because of destruction of the fat, because of the heat generated, because of the radiofrequency between the microneedles. So that's a little brief overview, I suppose, of the history of how they develop. But I primarily have used it for patients with acne scarring.
You know, when I first started dermatology in 2010 in the NHS, we were doing this derma roller treatment.
Did you do it at Ealing?
No, Lewisham.
I wasn't at Ealing, but I did it with Prof. Chew. I went to learn how to do it there, and then we did it at King's.
I did it with Janet Ross.
Oh, yeah. I mean, it was quite an aggressive procedure. People would leave.
It's painful.
Very painful.
It's really painful, yeah. When you're doing it, I think that one, it was the roller that we were using. So this is about 15, 16 years ago now. And it was painful. You'd normally put a numbing cream on first, just to try and take the edge off the pain. But it certainly is a painful procedure. But now with these stamps, although it's still painful, I sort of almost feel like there's a bit more of a level of control of when you're doing the treatment for someone. But have you seen those like microneedling stamps that you can now buy and do yourself at home?
I have seen them. And I think in the quest to have a device for every skincare company or every makeup company, a lot of them jumped on the microneedling bandwagon, didn't they? But they are very shallow in terms of their depth. So they're not really penetrating to what's going to necessarily make that big difference that we would see in our acne scarring patients. So as well as for acne scarring, and that is atrophic acne scarring, so the dipped scarring, not those large rolling scars or the ice pick scars, but really these boxcar scars, it can be effective. And also it's then secondary role in things like facial rejuvenation. Any other roles that you would use microneedling for?
Yeah, so I think for people that want to improve the skin texture and quality on their neck, for example, their décolletage area, then it can also be a really nice treatment for those areas.
And I've seen it done around the eyes, which, because the eye skin is so thin, I've actually seen it cause quite a lot of little kind of traumas around the eyes, which sometimes results in bits of hemosiderin deposition, which is the brown pigment, which is exactly not what people want to have. And even things as well, I see it used for conditions like melasma. What do you think about it in its use for melasma?
So for melasma, I've seen that someone else has used it. And then also for someone that's had a really hyperpigmented scar from a tummy tuck from abdominoplasty, and then they had microneedling done. It's like the pigment didn't go. I was like, no, can't imagine it would have done.
I'm not surprised.
But it's what we've talked about before. When you just have sort of one device, then sometimes it's just used for a whole myriad of skin concerns, but it might not be the right thing to use. So yeah, I don't tend to use it for pigmentation issues generally. It's normally for sort of rejuvenation of the skin, improve the skin texture on the neck and on the décolletage and the jowls. And it does result in a little bit of lifting, and it can improve things like acne scars, as you say.
Yeah, I agree. I would not use it for any pigmentation. The only other indication I would use it for is for scarring, in the same way that I might use a CO2 laser or something. If I didn't have the CO2 laser, if you live in a resource-poor place, then I think that microneedling can be very helpful for some of these very thick tethered scars. So that's the area that we would park it in. So Denny doesn't actually let us know why she's using it, but let's assume she's using it for acne. It says here she needs to have multiple treatments to see the benefits, and I would agree with that.
Yeah, you do need multiple treatments. So there's different protocols that most devices, so the radiofrequency microneedling, there's like the Morpheus 8, and we've got the Lutronix Genius, and they normally have a protocol of like how many treatments you would need for whichever indication you're treating it for.
Shall we perhaps touch a little bit on the downsides of treatment? So if we think about the downsides of microneedling, might be the recovery time afterwards. So you have a sunburn-like reaction, usually for a couple of days, and little tiny red dots can appear on the skin where the needle has entered the skin, and they'll all resolve, but they can last for a while. The derma roller is obviously associated with a bit of scuffing in a very small number of people. But, you know, if you're somebody who's prone to things like cold sores, then you'd want to make sure that you didn't have an episode of a cold sore at the time, because you could essentially spread that virus. So it'd be very important not to do that. And in terms of the microneedling radio frequency, which is where you have the microneedling and then the radio frequency is passed through, there's a few more downsides with that if not done correctly.
Yeah, so the biggest downside is fat atrophy that we mentioned. So just there's too much heat in the fat layer of skin, and then you can get atrophy, so loss of the fat, and then you're exactly causing the problem that you're trying to solve. Your skin will look more dipped, it will look thinner, and it will look unhealthy.
And that's typically caused whenever the needles have gone too deep and the energies are too high, and you're creating this environment where the fat essentially dissolves, and like you say, Ellie, you end up with these bigger dips than that you had to begin with, and the outcomes are not good, and it's quite difficult to then try and resolve. So if somebody's looking to have microneedling treatments done, so let's concentrate on the regular microneedling first. What's your advice? What's your protocol of how do you find a practitioner?
So you want to go to a well-established clinic where they do this procedure all the time. You want to make sure that they're using the right sort of equipment, that they've assessed your skin problem adequately, that they're not using it for a skincare concern that might not necessarily get better, like a pigmentary concern, for example. And you would also want to know that they know how to use the microneedling radiofrequency device that they have. Make sure that they're using it within the parameters that are safe. they're not going in with too high energy too quickly. You just know that you're going to have to space multiple treatments out to get the full results.
And also that the practice itself is somewhere that is regulated and, falls under the right kind of guidelines for delivery of care, because it was in microneedling, albeit delivered with PRP, which is a different kind of a treatment that sometimes is delivered with microneedling, where in a unhygienic, unclean place, blood has got mixed around and cases of HIV have been reported because of transfer of instruments. So this is something that you want to just make sure that the clinic that you go to is a very well-run, registered clinic, and the practitioner is somebody who is knowledgeable and understands how to use both kinds of devices, because perhaps the radiofrequency microneedling might give you a better result more quickly, or at least explain to you the difference in costs. And microneedling is much less expensive, and perhaps that's the right option. You just need a few more treatments of that compared to the microneedling radiofrequency. But I would say that's probably the tips to go to if you're looking for a practitioner. That's a wrap for this mini episode, and thanks to Jenny for your question. We hope that this was useful. Ellie, thank you again for joining me.
My pleasure.
And thank you, my lovely listener, for joining us. Bye for now. Take care of yourself and your skin, and don't forget your SPF. And see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.